Thank you.
Yeah, hi everyone. I'm Marilyn Van Ostrom, and I'm one of the co-chairs with Gretchen Toller. She couldn't be here this morning, but just want to welcome everybody. If you haven't already, if you would put your name, organization, and role in the chat. Um, and also, if you could um, rename yourself so we know, we can see if you're an HVAC member, a guest, DCYF staff, or a trio member. That would be really helpful. And I'm really excited about today's meeting. I think we worked hard on this agenda and thought, um, yeah, we're really thoughtful about what we felt was important to share. So I'm really excited about that today. We're going to get have a data discussion with Martha, and then a panel um, to look at true cost and rates update, and have LIAs who've gone over to rate setting answer questions about their experience. So it's going to be a really rich discussion. Yeah, so welcome everybody today, and I'm excited for what you all have as far as input and feedback for HVAC. So thanks.
Thanks so much, Marilyn. Next slide, please. So we just wanted to start off. This is our first, even though we met in July, this is our first like official meeting of the 2026 fiscal year. So we just wanted to be sure that we kind of did some housekeeping pieces. We've seen over the last couple of meetings an increase in the number of public members. So we just, again, want to make sure as we make our way through all of our meetings that we're just doing some housekeeping things, just to keep us on track of where we are and just to help those who are joining us for this meeting or maybe joining us for kind of the very first time, kind of an idea of HVAC and the way that things run and work. So we'll just spend a couple of minutes doing some housekeeping things, and then we'll continue on with our agenda. Next slide, please. And as we make our way through, I'm not going to spend a lot of time just kind of reading through the slides. I'm going to give you an opportunity, just a couple minutes to get yourself oriented with the information that's here. So again, it's more of kind of a regrounding and just kind of helping bring those who are not with us often along and kind of understanding HVAC in a very small snippet. So these are HVAC's values. So again, we want to maintain them and keep them in mind as we make our way through each of our meetings, and each of the topics that we cover touch on one or multiple of the values at each meeting. Next slide, please. And so then these are HVAC goals, again, is that we want to continue to keep in mind, and we want to kind of look at as we spend time over this next year. What are we doing to further kind of our goals? Do we need to modify them? So again, we just want to make sure that we're staying connected and reminded and grounded in what we've identified as a committee, our goals. And today we're going to touch on kind of the utilization of data under our goals, to increase some understanding, and then to really get us in the habit of looking at data together, thinking through what data HVAC would like to look at, and kind of how that feeds into our values and also help support where we're headed with our goals. Next slide, please. So again, some more just kind of grounding things. Want to remember what our role is as an advisory committee as we have moved through our time, as we think about the topics, as we kind of prepare for our year. Next slide, please. So I'm not sure if we have any public attendees with us today, but we also wanted to make sure that we're sharing kind of our expectations. One, we want to welcome you to the space. We're always happy to have members of the community and attending and participating and asking questions and being engaged. We just want to make sure that you are grounded in how we are expecting that to happen. So just one of the things I want to highlight as we're responding to kind of polls or as we're voting, that is strictly just for HVAC members. We will definitely, as we make our way through the meeting, have an opportunity for you to ask questions, to provide feedback, and the slide deck will kind of cue you as to where that is, along with the different presenters. We'll be sure to create some time and some space for that. And then again, if you're having any technical difficulties, if something is, please feel free to email Jessica Spencer privately. And if you can do that through the chat, you should be able to kind of select who you want to send a message to, and she'll be available and able to support. Next slide, please. So we have TRIO members here, and for those of you who may be new to HVAC, TRIO refers to the 3 agencies that support our home visiting services account. So we have Department of Health, who does our data collection, analysis, and reporting, and also have a DOH team member who chairs the data subcommittee. And then we have Start Early Washington, who does our technical assistance, some professional development, and also our CQI. And so you'll see a variety of different combinations, and then us, DCYF. So you'll see various TRIO members here. We just also want to be sure to share with the membership and then also with public attendees kind of what their role is in this space. So this slide, again, just gives you an idea of how TRIO members will kind of move and be in the space that we're all sharing together. Next slide, please. So Marilyn covered our agenda. You should have received it in an email that was sent out to you earlier. We have till 12:30 together, and then we'll have a lunch break, and our subcommittee meetings will happen from 1 to 2. So we'll cover 3 of major topics today. And again, as we say, as we spend our time today, we may find that there's a lot of engagement and participation in a certain aspect of the agenda, and we may need to kind of modify. So we are always kind of fluid and moving things around, and we'll be responsive to where kind of everybody in the membership wants to go. But this is our agenda, and that's part of the reason you see kind of large chunks of time, because we're allowing for there to be some flexibility in how things are accomplished. Right, next slide, please. All right. So we like to start off our time together, just kind of doing some community and relationship building. And so the question we'll answer today, and we'll this into Jessica, if you could, I think I should be able to do it. You can open some groups, some breakout rooms. I'll do it. I think I've got so put you into some breakout rooms, and question I want you to spend some time chatting about. We'll spend about 6 to 8 minutes, depending. I'm going to see how many breakout rooms we have, how many people in a breakout room. If your life was a TV show, a movie, or a book, what would the title be? And you can think about where you are now. You can think about where you were. You can think about where you're headed. So however, that part is open. However you want to capture and think about your life and how it would be reflected in a title is really kind of open to you. And I'm gonna, so it should be 3 to 4 participants They're in a room. So let's do let's do 8 minutes. We'll do 8 minutes and then I'll check in part way just to see if we are done or if we need some additional time. So again, if your life was a TV show, a movie, or a book title, what would it be? And again, that could be reflective right now, future, or past. Okay, so let's take a couple minutes and just spend some time together. All right, I'm going to open the rooms here. And see you back in about 8 minutes. Okay, welcome back. Hopefully that was enough time. I saw some conversation still going on, so hopefully nobody was cut off mid sentence. Um, do a couple extra more minutes because as I was watching, it seemed like conversation was continuing. Um, so there are a couple of brave souls who would be willing to share, what their title would be and what modality, and that can be out loud or in the chat or um, I would love to hear it out loud, but I also know that there are those who might be more comfortable putting information into the chat. So we'll give a couple minutes and see if we have some brave souls.
I'm always very participatory, Nellie. This is JP. My title would be, well, that didn't go as planned.
This is Malia, and my life would be a TV show. And when I was over in Olympia, having an in-person team meeting with my team on Monday, I stopped at this little store in downtown Olympia, and it was super cute. It had all these cute little toys, and it also had these stickers. And I grabbed one of the stickers, and it's a dumpster, and the dumpster is on fire. It has flames coming out of it, and then it says everything is under control. Um, and so that would be the image of my TV show.
Thank you so much, JP, and thank you, Malia, for sharing. And again, feel free to share in the chat if that is where you are most comfortable. Again, thanks for spending some time just kind of getting to connect and getting to know each other a little bit better. We're gonna transition here to our first. Oh, nope, we've got one more thing. So thanks I thought we were ready to kind of transition over. We got our last meeting decided that we wanted to spend some time going over the kind of the feedback after each meeting. We had um, one person complete the survey. We're also going to spend some time moving forward in the meeting itself, giving you an opportunity to provide some feedback. So I will share my screen here and we can jointly look at it. Give me just a second to get it up. Are you seeing the survey results? Probably a little bit bigger. Okay, thank you. I'm seeing some head nods there. Probably pretty small. We had only one person respond back. So I'll just pause here and give you a minute or two. Let me know if you cannot see it. If you cannot, I'm happy to read it out loud also, because I know it can be pretty small. And I am seeing people kind of trying to squint in. So I will just read it because it's easier. So the question is, what did you like about the HVAC meeting? I really appreciated that the feedback survey results were brought to the group. I think this is good practice. I think it's helpful when survey link is shared at the end of the meeting or within the next day or two. While the events of the meeting are still fresh for participants, I like that there was agreement to attach agendas and previous meeting minutes to the calendar invitation. The system makes it easy to find them for the meeting and easy to find them in the future. Happy for the discussion about recruitment, which voices need to join HVAC. What did they find challenging? Although I appreciated the results from the previous survey were shared, I found the question to the group about whether or not other folks shared those sentiments to be a little out of touch with the power dynamics at play in the room. I suspect that many people would not feel comfortable sharing their true feelings in that setting. What would you like to see changed? Share the agenda earlier when possible. And then the other two sections were blank. And so just pause to see if there are any questions or comments, HVAC members. Any questions or comments from TRIO members or from our public attendees? You mentioned it'll be an ongoing part of the agenda, so we'll have an opportunity to continue to review. And if there are kind of multiple responses, then we'll devise a different method to kind of look at multiple at once, rather than going through them one by one. But and this is our second time doing it, so wanted to continue to get us in the habit of spending some time together looking at results. And the survey link will be in our chat before we'll spend some time doing that towards the tail end of the meeting. So I'm going to stop sharing here. And I think we are ready to transition over to our data conversation. And so I will hand this over to Martha and Brad.
Yeah, thank you, Nellie. Good morning, everyone. I'm Martha Skiles. I'm with the Department of Health, and I'm joined here by Brad Close, one of our maternal child health epidemiologists at DOH. We are going to share two data presentations this morning. First, Brad's going to share out on the maternal child health block grant needs assessment. This will provide kind of a look at the health and wellness needs that we've solicited from across the state in the past 24 months, probably. And then I'll follow up with a statewide look at home visiting services from a population perspective. And this is new data from our pregnancy risk assessment monitoring system. So with that, I'll pass it off to Brad. Like I said, he's one of our MCH epidemiologists at DOH. He's been active in the last two cycles of the needs assessment and led a lot of the primary data collection for this newest needs assessment. With that, Brad, thank you for joining us this morning and sharing with the group.
Yeah, thank you, Martha, and thank you, group, for being so welcoming coming in and the fun early exercise. Just before I start going on too far, can folks see what looks like the intro to a PowerPoint presentation that should start with data review and discussion in a purple font? Can I get, okay, I'm seeing a nod, a couple nods. Okay, great.
Yes,
Just want to make sure. Well, yeah, thank you. So I'm mostly going to be talking about our maternal and child health block grant needs assessment. I can and regularly do spend all day talking about this, but I'm going to do my best to keep this to 10 minutes. So please just directly cue me if I blather on and go on too long. But also know that I'm doing my best to keep this relatively bite-sized for today. So first, I'm just going to give a little bit of background context for the Maternal and Child Health Block Grant. Sometimes this will show up as Title V in federal speak. So since 1935, the Social Security Act has provided funding for the Title V Maternal and Child Health Services Block Grant, so a robust history. The focus is improving public health systems to benefit mothers, children, and their families, with a special focus on children and special healthcare needs. It requires a 75% match from the states, so it is a significant investment on our part. It's tracked through a word soup of different measures, both outcome and process oriented, which that's its own day's worth of talking, but just know that we have a different hierarchy of measures that go with it. In Washington, it's been historically just under $9 million annually, with about 2/3 of that going out to local health jurisdictions and other partners. So it does fund work throughout the state in a very literal way. And what I'm here to talk more about is that every 5 years, we do a statewide needs assessment that updates our strategic priorities and kind of reassesses need in the state. And that's really where I come in here. So when you say needs assessment, I throw that term around so much, but what does it really mean in this case? So I'm going to break down a few of the activities that we did to learn about what's happening in families in Washington. First, I start by listing our local health jurisdiction activities because we really viewed our local health departments as one of the primary partners throughout this process. So we did key informative interviews with every single health jurisdiction that takes funding. There are one or two that don't at the moment, but most of the local health jurisdictions do work with us very actively on this. We worked some sneaky evaluation questions into our regular reporting with local health jurisdictions. So we ask, what are emerging needs in your community? What's popping up? And we really use those questions and listen to them and read them and use that to inform what's changing around the state and have that guide part of our needs assessment work. We did what we call here a reporting template, but we basically asked each county, what are the top 3 needs in your community? Where did that come from? Who did you talk to? What processes did you go through? Maybe it's leaning on other local health needs assessments or CHIPs or CHAWs or things like that. Or maybe you did something different for this cycle, but either way, we did our best to collect all of that. And once we had some preliminary findings, we worked with local health jurisdictions to kind of get an early summary, early prioritization, and really try to help make sense of it with that group in particular. Some other activities we did focused on DOH partners. We did a series of facilitated discussions, kind of hearing about what the status of families was across the state. And so there's the Care Coordination Family Advisory Council is one example, the Community Health Worker Leadership Committee, Neural Development or Centers of Excellence they have a network group that meets regularly. Youth Advisory Council, for us, that was a really big success because, believe it or not, youth don't always engage in our surveys and other activities. And so having a standing advisory council was a really cool way to get their voice directly embedded. Parent to Parent, Fatherhood Council. And then we also did this cycle kind of a different approach towards working with a couple different tribal organizations to do a tribal-led needs assessment that we then folded into our larger group. And so we worked with the American Indian Health Commission, Kaufman and Associates, and a few others. But wait, there's more. What did we do at DOH? Within each of our domains, and I apologize, I might accidentally use the word domain too much here, but the Maternal and Child Health Block Grant focuses on a few subsets of family, and so that includes perinatal and infant health, child health, children, youth, and special healthcare needs, adolescents, and women's health generally. So if I say domain, I'm referring to those groups that are kind of the pillars of the grant. And so some of them did specific needs assessment activities. For example, our adolescent young adult group did some youth and youth serving provider surveys really specifically. Again, that group doesn't always engage with us directly on our catch-all surveys. Again, I embedded sneaky needs assessment questions anywhere I could in terms of our program evaluation and working with our team for how we're learning how our communities are impacted over time. We also did our best to do something that resembles a literature review. And so we asked for 3 to 5 reports from each of those domains that covered what's happening in Washington. Part of that because we know that we're not the only organization doing needs assessments. We know this type of work is happening all the time. We know there's survey fatigue. We know that communities tell us the same things over and over again. We don't always hear it. So we did our best to really capture what else is out there and document it that we can draw from, build on, and all of that. And one that I'm particularly proud of, we did a discovery survey. The original idea from this came from Wisconsin, I believe, or maybe it was Minnesota. But basically, we had 2 very simple questions. What do families need in your community? What do families need to thrive? And push that survey out as far as possible. I also apologize. I have an open window and a garbage truck happening right now. So if there's background noise, it should pass. Okay, I'm seeing a head shake no. So glad you all are not hearing that. But we were really proud of this. We got over 2,000 responses, and that's after we limited it to Washington respondents who had something valid to say and not just blanks. So we had over 2,000 responses. It was in 11 languages. We actually put it out in 13, just 2 of them. We couldn't do social media advertising, and that showed. But we had a pretty wide-ranging net of activities, inputs, opportunities to tell us what's happening, what families need, what rose to the top. So when you put all of that together, I won't spend too long on this slide, and this is a little bit weighted towards that discovery survey just for number count reasons. But if you take all of the words and all of the documents, and so this is thousands of documents, this represents hundreds of meetings and different ways to organize notes, reports, survey responses, everything. These are the words that came up the most. And so the larger the word is here, the more often it came up. And if the word appears on this slide at all, it means it showed up hundreds of times. So if you see, like I know one time I shared this slide and someone called out, I think it was, there's something around school here that shows up as relatively small, but if it shows up on this slide, it means it was a really common theme. But what I really want to highlight is that you'll see housing, health, affordable, childcare, food. Some of those basic needs really came up from a frequency perspective a little more often. And so one of our challenges or opportunities in general was how do we take some of these more basic needs, social determinant of health type themes and connect them with the maternal and child health block grant work and home visiting, and that connection is one of the one way you could look at bridging that gap. A different summary we pulled together is this is just specific to the local health jurisdiction needs assessment summaries, but what were some common themes that local health departments highlighted? So mental health was a huge topic, specifically depression and suicide in youth. Health deserts. So looking at access to healthcare, specialty care, dental care, we came up with a number of maps that really found different ways to showcase this, but also a maternal health desert, knowing there's a lack of prenatal providers, birthing hospitals, postpartum care, women's health in general. A number of comments talked about not being able to access any provider unless you were pregnant, which really paints a picture. In my mind, that is connected to provider shortages. And then, as I mentioned, there were a number of basic needs concepts that were brought up, talking about financial security, housing, food security, childcare. And a lot of comments really did help us bridge the gap for if you are focusing on those things, it does directly impact your ability to access healthcare, prioritize healthcare, spend time bonding with family, all of those other things. So it's really not this separate issue in a vacuum. So I'm not going to go through everything because, again, I don't have your entire day. But I did want to focus on a few things that rose to the top in the domains that are more specific to this group. So one of them, I wanted to take a minute to focus on perinatal and infant health. We heard a lot about provider shortage of OBGYNs impacting access to prenatal care, accessible care in general. And in that category, people mentioned doulas and community health workers quite a bit. So that's one of the areas in terms of bringing care to where families are at and that we see a lot of opportunity. Perinatal health, mental health resources, and long wait times, if they're not always available, and if they are available, it's not usually a quick access situation, which especially if it is a emergency case is pretty problematic. Perinatal substance use resources and addressing stigma against birthing persons seeking support was another thing that came up. Looking at parenting support and I cannot tell you how many different conversations we've had around what parenting support actually means. How can we turn it into something concrete? I know the maternal health innovation team is really working on that as well. But a few things that we came up with include parent education, lactation services, support groups, and things that support material needs, and need for improved communication between patients and providers and between provider networks. Of course, systems work better if we all speak to each other well. One quote I wanted to pull out related to this: doula work keeps being promoted to break down silos and support families with positive birth experiences, but we don't have infrastructure in place to support local doulas and create a community that's welcoming to them and their work. Another domain I wanted to highlight here was looking at women's and maternal health. And so there are many barriers that limit access to preventative screenings, mental health services, and prenatal and postpartum care. We know there are OB/GYN provider shortages, especially in rural areas. We did our best to learn about support in the workplace with paid family medical leave and longer maternity leave and flexible workplace schedules. We know there's a value in those easily navigable, trauma-informed, intimate partner violence resources, but sometimes it's hard to get accurate information in those spaces. And a couple things that came up: economic challenges, including housing and childcare costs, have a disproportionate impact on women, especially when entering the workplace and looking at family planning. And there's always a continued need for STI testing and treatment. I'm going to spend just a second on children and youth with special healthcare needs. And I have a few quotes that really tie that directly to home visiting. But first, just talking about the shortage of support, respite care, and personal care hours, especially for children and youth with special healthcare needs parents. Provider shortages, primary care, mental health, dental care, where providers are well versed in and understanding and accommodating for that children youth with special healthcare needs community. Affordable and accessible caregiver availability, especially for those families. There was a lot of commentary around financial assistance and caregiver allowance type supports, the need for community building and a feeling of belonging, having special education services funded in school systems, and access to local resources for local Chichigan families. And I wasn't sure whether to include that domain in this presentation at first, but when I was looking through quotes from our discovery survey, a couple really reminded me of the value and connection here. And so two I wanted to share. There used to be public health nurses who made home visits to families with children with special health needs and helped them navigate complex systems of care so parents could be parents and not care coordinators. That was from one of our discovery survey respondents, and the implication being that those services weren't available anymore in their community, and that gap was being felt. This one came from one of our local health jurisdiction needs assessments. Home support for children and youth with special healthcare needs. There's limited capacity for home visiting programs to help families with children with special healthcare needs outside of their providers' offices. Again, home support, home visiting, what can we do to meet those families with those extra complex needs? So I thought that would be something worth highlighting for this particular group. And then, of course, child health. So affordable and safe housing and financial support, that came through across the board. It was just something that for us, we had some momentum in our child domain, and so made sense to talk about in this particular context. Affordable and accessible quality childcare. I don't know how many of you have sought out childcare lately, but it is a very, we'll say, competitive market. It's really challenging. It's not accessible for all families. Family bonding time and social emotional development. Pediatric specific provider shortages for primary care, mental health, and dental health care in rural areas. We made a map. Most counties in the state don't have pediatric specialists, period. So that's something that we know is a challenge. School safety for all children. Affordable indoor and outdoor recreational activities. Looking at birth to 3, that showed up also for birth to 5. Healthy relationships with caregivers, and I mentioned briefly, but how basic needs really can impact that directly, and stigma against caregivers accessing services. For example, single parents, abuse victims. There are lots of places where those stigmas can prevent people from accessing those services. And I know, at least in my world, we always have those conversations. If we know there are resources, why aren't they being accessed? And that is a part of that conversation. So we took all of this information and did our best to make something coherent and tangible out of it. And so we kind of came up with these 3 pillars of of categories that crossed all the domains, all the work we're doing. So looking at economic security and basic needs, we had a number of issues related to that. Healthcare access and quality, a little more directly related to the medical side of healthcare that many of us are familiar with talking about, and social emotional well-being and support. And that's really looking at that parent and caregiver support and how those relationships are built over time. But I wanted to just briefly look at one more concrete example for how do we take all of that and apply it in our public health programming. And again, I could talk about this all day, so I apologize if I'm going too quickly, but the example I decided to lean into, we came up with a state action plan. It was around 10 priorities. Each of the priorities had associated measures and activities. One I decided to highlight just for the purpose of this presentation in the perinatal domain was looking at the need for increased support for new parents and caregivers. And so one way we use this information, we had to figure out what are some performance measures and strategies that are associated with that. So we looked at breastfeeding initiation, looking at support for people who'd recently given birth and what that can look like. Some strategies that we either have in place or are building towards are looking at breastfeeding and lactation support, home visiting and newborn outreach, family housing assessment, which is something we worked with some staff with over the summer to get a better sense of housing needs throughout the state. This one's probably a little more aspirational, but a statewide resource and referral system that really works for families and serves their needs. And so we also have some more evaluation type measures, which I separate from performance measure being kind of like how's the population doing, evaluation measure looking more at what we are doing and what we can control and measure. And so a couple of the things we're looking at as we support that work are the number of hospitals utilizing human donor milk for at-risk newborns. And there's a lot more language to that, human donor milk or comparable solutions, but trying to keep it relatively short for this slide. And then percent of births taking place at LIFE certified facilities. And LIFE is one of our DOH programs that has supported a breastfeeding friendly environment and support for those giving birth. So I covered a lot of ground pretty quickly. I did not give too much space for questions, but I really do want to thank everyone for your attention and all of the work you all do that feeds into all of this, supports all of this, and meets the needs of families in Washington. With that, I think I'm going to pass it to Martha unless there is a pressing question. I have not been tracking the chat, so let me know if there is something I missed.
So Brad, thank you, Brad, for the presentation. There's no questions or comments in the chat. Would you share the actual assessment or where can we find it? So that question did come up.
Great question. I just want to acknowledge that at this particular moment, I think we're really grappling with what is the best way to transparently tell our story while complying with all federal guidance on what best language to use. And so we're a little slower putting stuff out than maybe would be at other times. I know the application that was sent in is available for public review. However, that's like a 300-page document that not everyone wants to probably skim. But we will try to get something more plain speak, understandable out in the next month or two to help people kind of review what are the main findings and what can we do with them. And I will share with Martha a link we have that she can share with the group that really breaks down what we found by those domains I mentioned earlier, looking at perinatal, infant, child, Shishkin, women's maternal health, and adolescent young adult. That we came up with a 4-page brief for each of those that really does summarize what we came up with, and that's what we used to drive the LHJ conversations. I'll just, Martha, is it okay if I just send it to you and then you can share it with the group in the most appropriate way?
Yeah, then we can share it out with the meeting minutes. So there was some notes of appreciation, Brad. There was a question, could you share the time frame when the data was collected?
Yeah, and to that, it's representing 2021 to 2025 this year. Really, most of the data was collected most fervently 2023, 2024. And so there is a little bit of that. That was one of our challenges in the last cycle is we did all this great data collection in 2019. And then in 2020, the landscape changed quite a bit due to COVID. And so there is some of that risk with this kind of 5-year cycle that you might miss something if your data collection isn't concentrated when the big public health happening is. But we did our best to be a little more representative this time, and like having those ongoing questions with LHJs, for example, throughout the 5 years. We had at least something from each of the 5 years feeding into our process.
All right, Brad. I encourage you to take a look at the chat because there's some nice comments and a couple other particular ones that maybe you could follow up with or follow up through me, and I'll communicate with Nellie and the HVAC. Nellie, we are running behind. To do the home visiting data part, I need it probably 10 to 15 minutes. Do you want me to go ahead? Do you want to take a break? Do you want to punt this to a different meeting? I don't want to, I know we're a little over.
Okay. I would say let's take a break and then we can come back and do your part. So we built in some flexibility. So I think we'll still be okay.
Okay. So 5-minute or 10-minute break?
A 10-minute break. So it's 9:57. So if it could come back at 10:07.
Great. Thank you.
So welcome back, everybody. Just let us know that you're back either by turning on your camera, dropping something in the chat, giving us an emoji, something to know that you, and hopefully this brief time away give you some a chance to get up, stretch, respond to some emails or anything else you needed to do. So I'm going to hand this back over to Martha. Thank you.
Thank you, Nellie. All right, so we just heard Brad give kind of a landscape view of some of the reported needs in Washington. Now I'm going to shift to looking specifically at receipt of home visiting services in Washington. And this will be a population perspective, which is a little different. Typically, we come to HVAC and we share out data that we've collected from the sites that are using HVSA funds to serve families. So it's data about families being served. This is a population perspective of a sample of families across the state. So I will dig right into it. Next slide, please, Brad. So PRAMS, or the Pregnancy Risk Assessment Monitoring System, is a joint cooperative project with the CDC. It was established about 30 years ago. We have about 30 years of data here in Washington. Washington is one of many sites. Most states participate in the PRAMS. As I said, it's a population-based survey. We sample about 2,000, 2,400 families every year. It's actually the birthing person we sample. We do a stratified random sample, meaning we do oversample by certain race ethnic groups in order to get enough numbers so that we can speak to some of the smaller populations in our state. And we have about a 50% response rate. The survey speaks to self-reported maternal behaviors and experiences. And then in 2023, we started phase 9. So this presentation will focus on phase 9. We had some new topics. Typically a phase lasts a few years and we use the same survey for 3 to 5 years. We just have our new 2023 data. So we'll be sharing that. Next slide. Okay, so some of the uses. PRAMS, we use this data to supplement birth certificates. So we have a sample that we draw, we have the birth certificate data from that sample, we survey these birth parents, we link that data together, and then we remove the identifiers. So the intent is to supplement birth certificate, which is more clinical and demographic data, with this experiential data that we get from the survey. We use it to investigate emerging issues like vaccine uptake during COVID or substance use during the opioid epidemic. Those are some of the kind of emerging issues we might look at. We also use it for programs and policies, thinking about, we've used PRAMS data to support the extension of contraceptive coverage by insurance. We've used it to, we're using it to look at the new parental leave policies that went into effect in our state a couple years ago. Some of the limitations for PRAMs. It is self-report data. So we only get back what someone is willing to share with us. Sometimes there's a recall bias, meaning we survey birth parents 2 to 6 months after their infant was born. They may not remember what they were doing pre-pregnancy or during pregnancy or what happened during delivery. So there could be some recall bias. We also sometimes anticipate that we're getting some desirability bias, meaning sometimes people don't want to report out on something that they think people will frown upon. So they may not tell us the truth about their smoking behaviors, for example, because of this idea of desirability. We have some low response rates for some groups, which is why we do some oversampling in order to see if we can get as much, have enough of a base population to do some estimates for this, to estimate statewide. And then we do have a small annual sample size, and that limits some of the things we can say, like we can't really do very good county level estimates. We often add a few years of data together to get a county level estimate. We're also looking at some different methodology to do small area estimation, and we have some of that data now available. It's a little older. So those are just some of the limitations to keep in mind. All right, so I'm going to start with looking at what's happening across the state, kind of a population view, who's getting services. So first of all, 1 in 5 respondents reported either receiving home visiting or doula support, either pre or post pregnancy, which is, 20% of the population said they got some of that support, which is fantastic. Looking at the home visiting, we had 16% reported they received home visiting services. 10% reported prenatal services, 13 postpartum. There was some overlap in there. So among those who reported some home visiting services, a majority reported receiving both prenatal and postpartum. But we had about 20% drop off after prenatal, after delivery, and another 40% add-on postpartum. So there was an influx of new families served postpartum. And then for reported doula services, about 14% statewide reported receiving some doula services. That could have been prenatal, labor and delivery, postpartum, could have been all 3, could have been just some of those. There was a select population, about let me see. I'm not sure the percent here, but there were some that only reported labor and delivery. They didn't have the prenatal or postpartum. So that just gives you the big picture of across the state, how many people reported services. Now I'm going to switch and just talk a little deeper about the home visiting. So who received home visiting services? And out of the total PRAM sample, we produce these estimates for statewide. So by age, we're seeing that 1 in 5 birthing persons age 35 or older reported receiving home visiting services at some point, either prenatal or postpartum. The next highest group is, the less than 25 and 30 to 34-year-olds, with the smallest reporting population being the 25 to 29-year-olds. Education, 1 in 4 of those that had less than a high school education or GED, 1 in 4 of those, that population reported receiving home visiting services. And insurance, the Medicaid, non-Medicaid populations responses were pretty similar. Next slide. Then we looked at race and ethnicity, and the way we looked at race was alone or in combination, which means that anyone who reported, for example, on the birth certificate, they reported being American Indian or Alaska Native. They are included in that top yellow bar. They might have also reported being Hispanic or Black or white. They might have reported multi-race. Anyone who mention that they were American Indian or Alaska Native is included in that bar. So these yellow bars are not exclusive categories. Someone could show up in more than one of these bars. But this is a way to look at the data to recognize that it allows us to look at multiracial folks by these different groupings. So you'll see that there's a slightly higher proportion of American Indians and Black or African Americans who reported some reported receiving services. There's not a lot of statistical difference there. As you can see, we have some smaller groups and some larger groups, but essentially, we're right in there 15 to 20% across those different groups. And then by ethnicity, it's equal across the two, about 15.5% reported receiving some home visiting services. And the last look we'll take at the population view is by geography. The map is divided into the DCYF service regions, which is how we often present our home visiting data because it allows us to aggregate some of the counties into a larger geographic area. The lighter color represents the lower proportion of those served, and the darker means a higher proportion. So we see in Region 3 that less than 10% reported of those surveyed reported receiving home visiting services, whereas Region 4, which is Seattle-King County, we see 1 in 5 or over 20%. Majority were between 14 and 17% across the other regions. All right, now I'm going to shift to thinking about among those on the survey who reported receiving any home visiting services. First, we'll look at the type of home visitor. On the left is those who reported prenatal home visiting, and you'll see it's the majority reported doula or childbirth educator, followed by nurses, nurse aide, and midwife. And then on the right is the postpartum. We see a little bit of shift away from the doula childbirth educator and over to other. And other in this case is typically included family members or friends, nannies, and then lactation consultants or breastfeeding advisors. So those folks would also come into the home. And we're seeing more of that in the other category. Next slide. Again, for those reporting prenatal home visiting services, we asked, how many visits did you get during your pregnancy? And as you'll see, a majority received 2 to 4 visits, like 45% of those who received prenatal care got 2 to 4 visits, and 1 in 4 reported 5 or more visits. The last thing I want to share out is around what topics were discussed by the home visitor. So survey participants were asked if during their most recent pregnancy, whether the home visitor talked about a number of different health topics that are listed here. And as you can see, over 90% of the participants said that their home visitor talked about their emotional well-being and about breastfeeding. Fewer, like 52 to 55% of the participants said that their home visitor talked about their own physical and emotional harm, challenges to their harm, and about the challenges of smoking and drinking during pregnancy and the effects on the baby. And then the last kind of grouping is around testing. So how many home visitors were talking with their families about birth defects testing, STI testing, and HIV testing. We only asked about this during the prenatal phase, so that I just want to be clear about that. Many of these topics may have also been covered postpartum, but it's only included in the questionnaire for prenatal. The last look we took, I wanted to kind of see if there was any differences arising based on type of home visitor and the topics discussed. So the orange bar is a a grouping of more of the kind of lay providers, educated lay providers, trained doulas, community health workers, birth teachers, that kind of thing, parents as teachers. And then the green bar is more of a provider that might have some clinical training, like a nurse, nurse aide, or midwife. And as you can see, emotional well-being and breastfeeding, those both are discussed broadly by both of those types of providers. Then we start to see a little bit of a gap and separation where the teachers, community health workers, doulas are a little less inclined to speak about some of these topics, or they just didn't come up in their visits. We don't really know why, because we're only getting the perspective from the caregiver or the parent who is enrolled in home visiting. This difference could be a reflection of the different home visiting models and what their curricula is, where their priorities are. Could also be reflect the training or comfort level of the type of home visitor and their comfort with talking about certain topics, their training around those certain topics. But we wanted to kind of understand that a little better, so we took a deeper dive there. And then that's it for the data. Here are a couple resources for our PRAMS website. We also have taken some of this data. In fact, Brad has been our lead on this as well, taking some of the PRAMS data and putting it into this perinatal dashboard. So I can put both of those links in the chat. And then we have an email for PRAMS. I will say that our 2024 data collection, while that is complete, we don't have that weighted data yet available. Our 2023 data is available. If there's any researchers, lots of our local health jurisdictions use that data. Our 2025 data collection has been delayed significantly. We are just starting. In fact, today we're just sending out our pre-letters. So we're looking at doing just 6 months of data collection for 2025. And that is it. I'm guessing that I'm wondering if there's any questions or comments. Please feel free to come off mic or put something in the chat if you like.
I'm just glad there's people like you, Martha and Brad, that like data and collecting all of it, because it's not me, but the information is important. So thank you.
Thank you, Allison. All right. Well, I think we can then turn it back to you, Nellie. And thank you again, Brad, for the presentation and for monitoring slides. Oh, there was one question. Just wanted to understand that there were also home visiting clients who also reported getting doula support that was not their home visitor. Yes. So that one slide I showed 16% reported home visiting, 14% reported doula. Often they were 2 separate questions. So you could report your home visiting and then later your home visiting type. But the doula question came later also. Did you get doula support during prenatal, labor and delivery, or postpartum? Often people answered both of those questions. So there was some overlap between people reporting out that they were getting essentially home visitors who were doulas, and they answered both questions. And it's really hard to tease that out into kind of thinking about, are there different ways we want to look at that? But like I said, this is first pass at looking at this data. We're hoping to do a little more with it in the future.
Thank you, Martha. This is Dila. I was the one that asked the question.
Hi, Dila.
Hi. The reason I brought that up is that, I know that there are not really that many home visiting programs in the state that incorporate doulas into their model. So to get to that level of 14 to 16%, what that's pointing to me, is that home visiting clients are also getting, in addition to their home visitor, birth doula support some other way. So for example, for Open Arms, one of the biggest places that we help to provide doula support, we've noticed, is to NFP families.
Mm-hmm.
who have an NFP home visitor, and we are augmenting their support by also providing a birth doula. This is separate from our home visiting program.
Yes.
So I think that's an interesting thing to capture, and because it just shows the increase in how many people are utilizing those types of services over
Mhm.
time. So yeah, thank you for pointing that out.
Yeah, you're absolutely right. There are people reported kind of all different stripes of services where they reported home visiting, they reported home visiting from a doula, they reported just getting doula care at labor and delivery, and maybe home visiting could have been from another service. So teasing that out where they reported multiple kinds of services, and people receive multiple kinds of services. So we decided to just report out of those who said they got home visiting. This is what we saw. Of those who said we got doula support, we know that it may have happened at different phases of the perinatal period. I'm seeing a note. Yes. So Dila popped a note in the chat about seeing the difference in outcomes when a family received overlapping services. The unfortunately our population counts for the survey are a little too low to draw out some of those comparisons yet. Our hope is that so the phase 9 just started in 2023. We have a year's worth of data. We have another 9 months of 2024 data that we'd like to add to this. And then we're hoping to have some more 2025 data. Then we'll be able to, I think, provide a little richer presentation of the data. So more to come, hoping we'll see some more in the future. All right. I'll hand it back to you, Nellie. Thank you.
Thanks, Martha. Thanks, Brad. Really appreciate your time this morning. And again, if questions come up after, feel free to reach out to Martha. You can reach out to me, and we'll make sure we get responses to your questions, and looking forward to more discussion around data as we move forward with our HVAC year. I'm going to hand this over now to Laura, who's going to move us through our next agenda item. Thank you, Jessica.
Yeah, thank you for pulling up the slides. And I am going to stay off camera for the first bit here. I have a baby who is not feeling well and did not sleep much last night, nor did his mama. So I am holding him, and I have some quiet music playing for him. If it is disturbing or you can hear it, well, Nellie, I'm looking at you. Please let me know and I can turn it down. Just trying to get him to sleep here after not very much. I also want to do a quick check because we are going to be doing a panel here after I had planned to do a little bit of context setting, a little history sharing around some of the finance and sustainability pieces. But we have a couple of guests who are with us, in addition to HVAC members, who are going to share about their experience implementing the home visiting rates over the last year. We're now 15 months into implementing rates, and that's something that we talked extensively with you all about at HVAC, really in state fiscal year 24. So I wanted to reflect and share on how some of that is going. And I believe I see you on camera, Wei-Ling. You have a hard stop at 11, is that right? Yes, you do. Okay. So I think what I might do, and this may feel a little choppy, but I think it'll be okay, is I'm going to just do a couple of history slides, and then I'm going to be shifting to the panel. And then I'll come back to the other slides so we can get to them, just because I think it'll be more rich to have discussion with the folks that are implementing. So I'm sorry, Jessica, can you advance to the next, we'll do 2 slides, and then I'm going to jump to the rates panel and then come back. Just wanted to provide a little bit of, and I don't know if anyone else, but I was really just taken in all of that data, Martha and Brad. So thank you so much for sharing it. And it's interesting because similar, the time frame that you were sharing, Brad, for the needs assessment 2021 to 2025, and here is some timeline pieces that you'll see that kind of align with that timeline as well. And I was thinking about some of the expanded doula work that we've funded and other work in other parts of the state, particularly with tribal American Indian, Alaska Native populations. And so I would just invite you, if you're still simmering on the data, to share anything in chat that was an aha for you. I took a couple screenshots, even though I know I'll have the slides, just because I wanted to sit with them a little bit more. So I know we're pivoting and turning direction a little bit to talk a little about finance and sustainability, and you may still be simmering on the information we just received. So please, I invite you to share any ahas or things that you're reflecting on with that in the chat while we do this pivot to thinking about some of the finance and sustainability or true cost pieces. So just, a couple of milestones here. The legislature requested that the Home Visiting Advisory Committee create recommendations in 3 areas that were submitted to DCYF and the legislature in 2022. And I'm sure that one of my colleagues would be happy to put that link to those recommendations in chat for me. I had not queued them up to do that, but I know that they are well skilled and will be able to do that. And there were some recommendations related to true cost. And after those recommendations came in, the Department of Children, Youth, and Families did some shifting around how they're structuring payment across service lines. And home visiting was a part of that, moving to a rates approach. So we did rates planning and work over a couple of years and moved to implementation with rates for some of our models in state fiscal year 25 was our first year, and our other models moved either to rates exempt or rates pending or not yet there yet. Home Visiting Advisory Committee data and evaluation requested some evaluation of the rates initiative that we DCYF declined initially, and then we've also had some expansion work and recommendations that the Home Visiting Advisory Committee weighed in on as well, related to general startup, and then the ESSB 6109, as you all remember, that was last fall, and then there was, a state budget crisis that came into play. And so really the only expansion that happened last year was the general expansion. The department did not move forward with the expansion with 6109. Anyway, so there's been a lot going on with finance and sustainability, payment models, things like that over the last few years, and HVAC's input into that. So I just wanted to do a little bit of that. And then if you can move to the next slide, please. This shows a little bit more about that. So digging a little bit deeper around what's been going on as it relates to budgets and some of the things that are happening in home visiting services account world. These are just a few, again, pieces of data information as we reflect on where we're at, where we've been, where we're at, and some of the experiences of our program. So there's been a significant impact of rising workforce costs, really state fiscal year 22 to 24. That's not stopped, but just there was kind of a big shift as a result of COVID. I was looking at some data. Seattle, King County had higher than national average by, I think, more than 1.5% of higher costs and increased costs than other places. There were some increases to paid family medical leave, but in general, there's been across social services and healthcare, there's been increased costs as it relates to the workforce. We also had some limited time supports that we've been able to work with you all at HVAC to advise us on, and then home visiting programs to implement workforce incentives in a couple of rounds. We had emergency supplies and concrete goods that have been issued to our programs. Programs have done an amazing job adapting to and implementing those things. We had service expansions that happened in state fiscal year 23 that followed a procurement in 22 into 23. That was the Fair Starts for Kids expansion. And then the most recent one this last fiscal year was 6 programs expanding. We looked back at our budget adjustments and how we've been able to address some of these, though, we know generally insufficiently across some of our areas. We did a 7% increase that we thought might be a one-time increase in 23 that we were able to sustain in 24, and then again sustained it on an ongoing basis. We did a 7% increase for NFP and PAT, and then we did a budget increase for rates exempt models between 5 and 15%. And then our rates implementation happened in state fiscal year 25, where we quote unquote fully paid for the rate that was identified in the rate development process, and then have tried to do some additional adjustments in this fiscal year that we're calling rates informed. It's not implementing rate because we're not paying the full rate, but trying to again address some of those gaps and knowing that we're not fully covering costs for some of our models yet. So again, those are just some data points for the last few years. I know that's a lot of information, but wanted to do a little bit of where we've been, you know, where we, because part of the discussion we're hoping to have with you all is, what should we look at going forward? What's the context we're at? This is not a decision making or a vote today, but we do want to have some reflection and discussion with HVAC about, given all of this, are there any priorities or considerations DCYF should be holding going forward? All right, so that's a little bit of background. We'll come back and I'll cover some of the other slides later, but I think that that's sufficient context. So can you flip to the slide that says rates-based payment? Keep going a little bit further, a couple more. No, okay, right there. And I can share a little bit more about this at the panel. So we have 4 programs that have joined us, and I've asked them to introduce themselves here in just a moment as well. And then we have just 4 open-ended questions for them to reflect on. These, what are noted here, and some of the strengths and challenges, these are really DCYF's perspective of some of the strengths and challenges, and then our programs will share with us their strengths and challenges. So some of the strengths we've identified is we have seen that all of our rates-based programs have had an increase in the funding that they've received from the year prior to rates implementation to their rate. While some of those are very slim increases, others are larger. That's allowed some of our LAs to do increases in salaries. There's had an increased visibility of home visiting across DCYF. And the fiscal reporting is a little less every month, but it's still pretty complicated in the programmatic reporting. And we know that some of the LAA rates are still not covering the cost. And then we know particularly the Parent-Child Plus rate is rather challenging with the school year and non-school year rate, as that model is a 9 or 10 month implementation model. So those are just a few of the pieces. And I know I'm talking fast because I want to hear from programs, and I know Wei-Ling has to hop, and we want to hear her brilliance here before she hops. So if you could go to the next slide. And I don't know if it's possible to spotlight our lovely colleagues who are here. And I didn't catch Jamie's name on here, but I know Jamie is here also from Open Arms. But Allison, I know you're on camera. You can give a little wave, who is an HVAC member and the Family Haven program manager. And I hope that I'm saying this right, Faromsa from Horn of Africa. Are you able to come on camera? I saw you on earlier.
Yes.
There you are. Did I say your name correctly? I checked with Christina, but I want to make sure I'm close.
It's correct, yeah. Fromsa.
Okay, awesome. Welcome. Wei-Ling, I saw you. Hi there. And Dila, who's an HVAC member as well, joined with Jamie from her team. Awesome. Okay, and I don't know if we don't have a particular order. I sent an email yesterday with, the questions that we're going to talk about. But the 2 starting questions, and we'll start with the first one, is what were some of the bright spots of implementing rates for your organization over the last year? And we'll follow that up with the sticking points and challenges. But why don't we start with any bright spots for implementing rates for your program over the last year? And anyone is welcome to come off mute and share.
Yeah, I can start. Fromsa. Can you all hear me?
We sure can. Yeah, go ahead.
Yeah. Okay. So my name is Fromsa, and I'm with Horn of Africa Services. I'm the early learning program manager here. So our Parent Child Plus program is funded through DCYF and then through United Way King County too. But I'm talking to the the funding that the source that we get from the funding that we get from DCYF. And so the bright side, the thing that we get from this rate based payment is the broad part. It's provided the clarity in determining staff compensation, which means it gives us the structured and transparent way to calculate the pay rate for the home visiting staff. So now all the staff knows, the management knows, and the accountant knows how to calculate the payment, the rate for a staff. That is one thing. And the other thing is it helped us to feel more confident that we're within the comparable range with other agencies out there to pay. We know that we're paying at least what others are paying or very close to it. That gives us confidence. Before that, we don't know how much other agencies are paying, and we're always we think that others are paying more than us, and then at some point we might lose program coordinators or early learning specialists to other agencies. But now at least we know that the range, we are within that range, comparable range. And the other thing is this we believe contributed to the staff retention. We're not worried about that. Once we get that the rate-based payment system, we started. We increased the hourly rate, and then now we have comparatively we have happy staff. A good outcome. These are some of the things that comes to my mind. The others can add on it. It's the first question, right?
Yep, you got it. Zila, Wei-Ling, yeah, why don't you jump in? Go ahead.
Sure. Good morning. This is Hui-Ling Chen, she, her pronouns. I'm the program director with Family Youth Services with Chinese Information Service Center. Just like Formosa, we're also doing the Parent Child Plus program. I guess the biggest, I would say, success would be last year was the first year since 2014 our program was not in red. I think that's the great success from the RAID program. Just like Formosa saying that we were able to increase the workforce salaries, and also I think like oftentimes the most challenging thing is like the unpredictable like mileage cost now was count into the direct billable allocation, which is that you could do whatever mileage spent you could bill directly. So I think that's also a great, because I think years after years we always struggle with the traffic, because with the mileage cost, because we serve family all over King County, and the ELS mileage could be even more, like one ELS could have more than $1,000 a month cost. So I think that definitely has helped us, and I think those are definitely in addition to what Formosa was saying, these are the highlights I've seen.
Okay, I'm going to put the next question in chat. And you can also see it. What were some of the sticking points or challenges for implementing rates for your organization over the last year? And anyone can speak to that too.
I was trying to pause to allow Delia to start if she wanted to, but I will start. This many people know, we have struggled here in Tulalip with moving to this rate-based system. And I think the reason it impacted us so negatively was we had to replace a home visitor. And when something's set up to be rate-based, you do not have the opportunity to have that person fully trained, do all the steps and work that needs to happen to build up a consistent full caseload. So we were running in the red for the last probably 6 months. And for us, it's becoming a point because of other financial issues that are happening for basically everybody and all grants and all that. There is not the flexibility for other programs to cover the cost. And so this is like a heavy reflection time for us to figure out if we can do this, I mean, right now I'm trying to find $24,000 to cover what was overspent. And I don't have $24,000 to pull from something else. So it has unfortunately created a huge barrier for us. And it's hard because this work is so important. And it's so important to get the right people in the positions and have them learn and have the opportunity to be involved with the community so the community will reach out to them and be comfortable with having people in their home that are working with their most prized, loved possession, their children. So this has been really difficult for us. That's the shortest, simplest way I can explain it. So I'll stop there.
Hi, Allison. Thanks for giving me the grace. I wanted to let you go first. So, um, just as a bit of context, Open Arms has been part of the HVSA for well over a decade. So some of the complexity of implementing rates had to do with the fact that we were also a legacy program and we had to transfer to this model. So I didn't talk about bright spots, but I would agree with Ramsa that, it did help to show what the true cost of our work has been relative to what the grant was that we were receiving, and that is positive. On the other hand, it has been extremely challenging for us. Again, we are not one of 50 programs in the country or 500. We are unique. There is no other program like us. And so in the state or nationally. And so when you don't have a comparison and you are the person setting the comparisons, it can be challenging. So for example, rates factors in the salary costs for different home visitors based on their credentials and experience. There's no salary qualification in the Department of Labor Statistics for a birth doula who's also a home visitor. It just does not exist. So we had to really take the step of saying, this is what we think our persons should be paid and their actual experience. And then also for equity and other reasons, we don't require bachelor's degrees. We don't require other certifications. Many of our doulas actually have master's degrees, but that's not a requirement for the position itself. And so the conversations about the unit cost value of the salaries for our home visitors took a lot of time, and I think it is still understated. And I think part of that is just with the complexity of shifting to rates. This was hard for everyone. I just want to acknowledge that for the home visiting services team, I know how much work this was for you as well. So it was for everyone. By the time we actually signed the contract, we were 3 or 4 months into our contract. And then we had to hurry up and try to spend it. And so we actually ended up in a situation where we knew within a month, like, we don't know how to spend these funds. We need these funds, but we have very specific buckets of how you'd like us to spend this, and we may not be able to spend it that way. And the lack of flexibility was very challenging. I think in a lot of ways, the contract structure for the home visiting contracts was not at the same place that the rates conversation was. Like the contracts themselves didn't reflect some of those things that the rates were trying to do. I would say that the rate setting process and deciding what our rate should be and conversations about that, and then ultimately signing and creating a contract. I'm saying this as someone who has done this now for 10 years, and I have branded funding from multiple sources. I think it probably took 10 times as much time as any other contract that we have. And that's, I think, an underestimate. And there was a lot of us teaching in there of like, nope, that's not right. Nope, that's not right. And we did not get compensated for that. There's limits in the rate setting on how much leadership or management is compensated versus direct services. So a lot of that time, that factor of 10 was borne by the organization. So I just want to point out that for organizations that are really unique and aren't part of a big, I don't know what the word is, cohort, franchise, it is very, very challenging. And I appreciate the intention behind the rates. I really do. I know that it was well intentioned and there are bright spots. It has been extremely challenging. And I think it's important for people who are considering, who may be moving that way, to factor in the uniqueness of your programs and to advocate for that uniqueness, because that's what makes your program successful.
Yeah, it's Fromsa again. I just want to add one challenge. As I said, our funding source is different, and when we move the DCYF to the rate-based, and then the other source is not. So that was a problem in the fund that we get from through United Way. It is there, and the staff, we have about 4 staff on that fund, and then we have another 4 staff on DCYF, and the DCYF, the staff that is under DCYF, they're getting increment on their rate, but the others are not. So that was a challenge for us. It's I call it adjusting pay equity within our team. That was a challenge, but we come up talking with DCYF, and then and with United Way, and somehow we overcome that. But that was a challenge, just to mention it.
Another challenge we have experienced was that when we go through the process, as Dela said, it was really long, and some I would describe sometimes could be painful. But and also when we were discussing it, I think at the time the national for the PC Plus model was 13 caseload per each early learning specialist. But when we start to implement it, then the national has changed that caseload to 12. So then we got stuck with the caseload of 13, and then as you know that we have another funder, United Way Best and Best Start for Kids. They're sticking with 12 caseload, but with the DCYF contract would be 13. So it's really hard to explain to the staff, the ELS, how come you're getting 13 and you're getting 12? That become the biggest challenge. And then in addition to, I think the slide was also showing that the summer, the 10 months program versus the year-round program, just implementation wise, it has been a big challenge for us.
And if there are other thoughts that you have as you've heard your colleagues speak about a bright spot or a challenge, please don't hesitate to come back to that. Wei-Ling, I know you have to hop off here in just a couple minutes. So I dropped in the next question, which was, what would you like DCOF to consider in future years of implementation of rates? And then the last one is key lessons learned to help any other peers who aren't currently in rates or who are in rates. That would be helpful. So just want to make sure you have the next opportunity to speak, and then others can jump on. And thank you for your time to Wei-Ling and leadership in this.
Thank you, Laura. So I think I would like to see if that, as I said, with the case rate, I wish there's some flexibility that we could adjust that, even though the rate has been set, but because situation had changes. So I think I would like to, have that flexibility. And then also, I think for, the lesson learned, I think as we all talk about the process itself, it could be we're the first batch to go through that. So a lot of time it was unclear. We weren't sure what is this is going to leading us to. And then also feel like, after the whole process, the end result may not really reflect what we have discussed about. So I think maybe we can learn from this process and try to streamline it, and also let the, when you're doing the rate setting, have the providers understand each step. Why are we doing this? So we make it have more sense, instead of some, that may create some frustration at the end. So that's all I have. Thank you for having me. Sorry, I have to hop off for another meeting.
Yeah, anyone else, feel free to jump in. What would you like DCOF to consider? Any other challenges or bright spots that are you're still reflecting on as well? Kayla, go ahead. I see you're off mute.
So one thing I think that will be complex for some other models if they're implementing rates that we found is, so for us, our program spans multiple counties. It is mostly King County, but we also have families that we serve in Pierce County, and we have families that we serve in Snohomish County. And we actually have a lot of demand for services in general and support from Pierce County, which, statistically, based on a lot of HVSA data, we know is an underserved part of the metro I-5 corridor, Western Washington area. The rate for serving a Pierce County family is less than the rate for serving a King County family. And back to what Wei-Ling is saying, it's very hard to explain that to staff who know that those Pierce County families may actually have access to fewer resources just because of the sort of the resource map of King County versus Pierce County. And that has created some challenges for us. We have to essentially balance that out internally, because we are compensating everyone the same, whether or not their family is from Snohomish County or Pierce County. And I just worry that that is based to salary scales for different areas. I just worry that that's kind of further cementing an inequity that I worry will just sort of disadvantage, especially some of our rural home visiting providers, where salaries are low, but also the need for your services is so high there. And the need to recruit home visitors in those areas is so high. And so that's just something I think that it's important for DCYF to continue to consider. And I think just ways of, on one hand, if the rate is a rate, then we should be paid that rate. And there may be times where that exceeds the income, the costs, and there will be times
So I just want to say, Delia, we cannot hear you and you're frozen. So I don't know if you want to go off camera and try talking, but I want you to say what you have to say. So hopefully we can hear you.
And if you can hear us, we lost you about at the, oh, okay. I wonder if her Zoom crashed, maybe. We'll pin, I think she was talking about the rural concern about rural and there being, there we are. Okay, now we can see you again, Dila. I think you froze for a sec. You were talking about, you're wondering the need in rural communities and concern about whether the lower rates in rural communities, high need and workforce challenges would further cement inequities, I think is where we lost you. I don't know if there was a thought you wanted to finish, sorry.
Oh, no, I'm sorry. I'm visiting family and they don't have a strong Wi-Fi. I finished my thought. It was just basically if there's differences in rates for rural versus urban or even peri-urban, how that gets passed on. Thank you.
Sarah, Allison, anything you'd like DCF to consider in future years implementing rates, or that you want peers to be thinking about or knowing about?
Yeah, so I think this is said, but for DCYF, if in the future, if you you know, this is our first time doing the rate base, so I hope you know, the lesson learned, we always bring that, and then we use that to make it more clear, more easy to implement. So if you consider about the you know, the geographical location mentioned by other people, that you know, my staff might be from King County, but visit the Pierce County family, it's a long way. They have to you know, drive there, and you know, if we can consider that in the future, that would be one thing I want to say. For the question number 4, that I don't know if I'm different from other people, but the process was very long. But it's my first time to sit down with funder and talk about you know, the rates. It's at least for me, it's my first time, and it's something that should be encouraged. That's a lesson learned that I learned, and I was talking to the executive director at Horn of Africa Services. It's our first time to sit down and discuss about the rates, how, you know, what should be the rates, and you know, in the whole process from the very beginning to the end, we were part of this, and that is a big thing. That is that should be considered a success for DCYF, and I know there are things that we need to fix, that you guys need to work on it, but it's success. It's something that needs to be on a big blog, that you know, funders can sit down and with agencies, the implementing agencies, and set a rate for their staff. And you know, as I said, it gave us, you know, a clarity, and you know, how to you know, the structure and transparency, and how to discuss about rate within our organization here. So it's a good thing. It's a big lesson that I learned there.
Hello. So I know this was a struggle for everybody, as Delia shared already. And you know, it's hard to be the first. Lots of things get tried out. And you know, even with people going in with best intentions, still things get lost, forgotten, misconstrued for, you know, the purpose of everyone. And that's kind of the hard part. The bonus about rates is it might be helpful for groups, but it also is a cookie cutter. And so sometimes it's hard to make it's hard to adapt a current ongoing program to fit a specific hole that we're supposed to fit into. And so I would say was a huge part of this for us. And, you know, just because a program, a head group, like for us, it was Family Spirit, says an average caseload is something. That doesn't take into consideration all the uniqueness that you are doing within your agency. And so to just kind of say everybody will do the same work is really not true. So that's one little part for me that has been really difficult as we go through this process. Delia shared something that has, in my world, has been very, very apparent. This has taken a lot of time to go through. It's taking a lot of negotiations within the tribe as well as with DCYF. And, you know, we don't have anything set come January still. And we've been waiting for replies. And I know DCYF has their systems they have to go through, but exploring this has been immensely difficult and stressful from the perspective of being in over a program. So for me as a manager, I would say this has been super painful. Just to be honest, it's really not been a good experience. So we've learned a lot. And I totally do appreciate, you know, Ashley and Renee for trying to work with us and trying to support us going through this, but it has not been good. And we're still, like I said, struggling to figure out how to move forward come January. So waiting for responses between both parties as you're trying to work for and don't have a current contract is very stressful. For the point of what would be helpful, maybe for DCYF to consider moving forward, is having the opportunity to have touch-in meetings to see how things are working for groups and be able to respond maybe more timely instead of each question taking, I don't know, 4 to 6 weeks going back and forth. I would also say I understand that so many things are built into a rate, but our indirect, I have no control over. And our indirect gets taken. And so when Delia was expressing there's this extra pot of money that we're supposed to be able to use, there's no way I'm going to use that specifically for mileage. And having it so narrow of those categories has really affected us. And if we were able to utilize that indirect or that direct billing, in a more useful way, we would probably be breaking even. But I kind of feel like that was a fake carrot put in front of us, that there is this money that you guys will be able to use that will help, but then it's so specifically what you can use it for that it's not really usable. So I that's been super frustrating for us as well. So I think really looking at that, DCYF, important people, for how it impacts actual agencies doing the work, really needs to be looked at. You know, and I would say I totally get it that having a beginning point is important. But you know, Nina, as I said, the title of mine would be not even to the level of this person who coined the phrase, but good trouble is something that I feel I need to do, and that it feels very specific to these underserved communities, that they were kind of targeted first to go through the rates. I'm not saying that was your guys' intention, because I know we do different things than Nurse Family or all these other places, but you're impacting groups that are specifically serving people in a different way. So I kind of challenged DCYF to think about that, and what that looks like, and maybe, I don't know, just consider that in the way that you're looking and making these changes. So I feel like I should end on something really a lot more positive than that. So Lord, guide me into saying something maybe a little bit different.
No, I appreciate what you were sharing. I don't
May I just
you don't need
add?
to close anywhere. Oh yes, you totally can. Sorry,
So
Dila, you're not spotlighted anymore. So
Oh,
please share.
sorry.
I don't and maybe no, it's not something you can do. Jessica or Nelly, can you help spotlight Dila so we can see her? And actually maybe we can just take the slide down, and then we can like see the whole group now, and just have a discussion. Please share, and we'll just do kind of an open
So
dialogue now.
Thank you. I just wanted to start by saying, Allison, thank you for bravely sharing the experience, because that takes some courage and strength. I mean, this is us speaking to a funder about our experience with their funding. So just to acknowledge there is a major power dynamic there, even if you're only asking us about all the good things. I just want to underscore something that she said of like, I would encourage the HVAC and the HVSA to look at the composition of the groups that have had to go through this process first, and how it relates to the greater cohort of HVSA funded programs. Many of those that are on this panel, we serve predominantly people of color and are predominantly people of color organizations. And so when we have to do the figuring out of, no, this is actually what this position is worth, we actually have to do that sometimes twice as much as other groups. And so for us to go through this first has been extremely challenging. I honestly think it would have been helpful if Allison and you and I had been in the same meeting sometimes, because I have a feeling we would have been saying the same things. And we've been saying them separately, and I think there's a lot of shared commonalities of what we experienced. So I believe the intention of this work is a healthy, equitable intention. And I think I'm going to be optimistic and say, I think it is possible to do this work more equitably than it has been done. And I think I would start by listening really deeply to the experiences of these groups that have gone through it first, because it's not just colored by going first. It's colored by how we were chosen to go first. And I just think that is something I've shared. I'm not sharing anything that I haven't expressed in an email or something else some other way. And so just please keep that in mind, because that's where the equity conversations are. It's not just the choices that were made, it's how the choices are made. So thank you, Laura. And I'm just wanted to back you up, Allison.
Thank you, and thanks for sharing. And I'm glad we're having the conversation. And it's, I know there's been individual conversations, but this is the first group conversation after a year of implementation. So thanks for offering your perspective and wisdom. It's 11:15. I know we are a little over our time, but I want to just say maybe a couple minutes, 5 minutes or so, if HVAC members first want to, if there's any questions or reflections that HVAC members want to share for the panel, and then open it up to guests. And maybe you could raise a hand or put it in chat if there's anything you want to share or ask as a starting point. I don't see any HVAC members, so we'll just open up to the whole group if there's any other thoughts or questions people want to share or offer.
Okay, I finally got my hand up. I have something to
Yay,
say.
Katie, there you are.
Hi. You know, I really appreciate everyone sharing, especially Allison and Dila, as you shared the challenges. And for Mosa, I think you hit on something important, which is just that like contracts are meant to be negotiated and really discussed, and not all agencies have the experience to set that expectation for themselves. But I guess the other part that I'm just reflecting on is sort of the situational differences between Dila and Allison, and how like Dila Open Arms is maybe able to absorb some of the challenges, not just the actual costs, but to have a little more flexibility in addressing changes, because the doula work is their primary purpose, versus Allison being situated within a much larger entity. And I don't know anything about how things are structured for you, Allison, but I can make some educated guesses. And so I think that's another place for DCYF to reflect on how, you know, attempts to be like equal is not equitable, and how to support different agencies and programs, because that's kind of what we're talking about here, right? Like a program versus an agency to a certain extent, and that some places don't have the ability to move things around, or extra money coming in, or fundraise independently. And while that's not, I mean, that certainly doesn't reflect the true cost of providing services, it is just a reality of where we are. And so how DCYF wants to think about that going forward.
Yeah, I appreciate that, Katie. It's a little bit of quote unquote provider type, but also program size. Allison, as reflecting on the what you shared about having staff transition in a very small program, and when you're in a rates structure, that can almost be like a startup again when you have, you know, 1 or 2 home visitors, and how that impacts how much revenue you have to support that, versus a larger program that may have 3 or 4 stable staff and 1 turnover. Is a little different, you know, than even a program of 1 or 2 home visitors. So yeah, thinking both, Katie, I appreciate your reflection on organizational type and how much flexibility there is, but also size of program, to me is something that I heard, and how rates impact that is important as well. Anyone else want to come off? I see, of course, appreciation in the chat. Renee's confirmed, Dila, what you said. It's 100% of our 8 programs. I shared that in chat too. You might not have seen that. There's 8 programs that have that are implementing rates in our 2nd year now as well. Well, there may be things that come up as well. And for Ramsa, thank you so much for joining us as a guest and sharing your experience. Dila and Allison, thanks for sharing. And of course, we thank Wei-Ling, and we know she had to hop, but wonderful leaders that we get to learn from. So thank you for sharing, and heard you. This took a lot of time and effort that wasn't compensated for to get there to implementation. So heard other things, took other notes, and know that others may go back and watch this too, and we can share that your perspective. So thank you, thank you. I am thinking, Nellie, just want to do a quick time check. I could go back and share a little bit, go back to the 3 or 4 slides that I had not shared on, and then move into the last part of the conversation before our lunch break. Do a quick check with you on that.
Yes,
yeah.
we have time, Laura. Please feel free to
Can
go.
you take us off pen so my big
Yes,
old
I
face
will.
is not staring at myself? So thank you.
I will do that, Allison, even though I enjoy seeing your beautiful face in the spotlight. Thank you.
Awesome, thank you. And Jessica, if you could pull the slides back up, let me see, I have them on my side too. This is a little out of date, this slide, and I just have not had and drawn in the right capacity to get it updated. But what it does is a visual depiction of kind of the complex nature and the different funding streams within the home visiting services account. And let me pull it up on my side because there was one other point I wanted to make here. My notes. So, you know, a part of that is that at this point, we still don't have approval for McPhee to implement rates. And in this picture, it looks like McPhee is stagnant, which it has been, but we actually now in the last couple of years have a little bit of an uptick of federal funds, and then state funds are narrowing just a little bit. If you could go to the next slide. And this kind of picture shows that what I shared earlier in the 22 to 24 period. So we had a big state expansion that happened. It shows here in 22, 23, that was the Fair Starts for Kids expansion. But then we see it kind of like the state dollars look like they're actually decreasing, or sorry, excuse me, this is a picture of the slots. I should have prefaced this. This is slots that are funded by McPhee, TANF, Dedicated Cannabis, and General Fund State. But what we see here is kind of some of our buying power is going down. So DCYF has gone in through an effort the last couple of years to do a little bit of what we've called rebalancing. It's looking a little bit more at what we're paying for the number of slots. So we know that even if we can't increase some of the contracts, which we have increased a little bit of the cost, it hasn't been sufficient enough to manage the increased costs and pay fully for the slots. So in lieu of that, that's where you'll see here, we had kind of a big bump of slots in that 22, 23 with a Fair Starts for Kids. And then we've adjusted again in 24 and 25 when we haven't had increased resources, financial resources again. And so our number of slots has gone down, even though, and then also we had this last year, we've had a couple of programs that have discontinued services as well. So I wanted to accompany that finance kind of looking at the dollars with the number of slots so you could see what adjustments have been made over time to support the slots as well. I think we have 3 more slides maybe, and then a discussion. We were asked a couple of legislative sessions ago to report out twice a year on the home visiting services account balance. And this again is one of the interesting things if you're new to the Home Visiting Advisory Committee or you're a guest here. This is a visual picture of kind of what I'll describe. The Home Visiting Services account is unique. It's a dedicated account in the state treasury, which means that funding does not go back into the general fund every year like other kinds of program services that are funded with general fund state. It's kind of like a container, if you will. It's a specific account, and it's one of very few that has both state and federal dollars that are integrated in, but really only state dollars contribute to the account balance because of the way federal grants work. It's in and out basically. So what this picture is trying to visualize is we have this account, we have money in the account, but we don't really always have authority to spend it. We got authority to spend the account balance a couple of years ago, and we've been working with HVAC to advise us on ways to do that. So we decrease it over time because we know that in lean budget times like we're in right now, it is at risk for some of the money that's in that account balance to be taken. And that to some degree happened this last year where our overall budget was decreased. So anyways, I wanted to give that visual. It's like we have this pot of funding, we have the additional funds, the popcorn that's outside of the bucket, but we can't actually do anything with that. So, or we haven't been able to do anything with that in the past. So I was trying to share, and you all can give me feedback on this, create a visual for a complex issue, and happy to have a different approach for that, but just wanted to share that as well. So if you go to the next slide, I'm just going to share the numbers. This is not final because we're still not quite closed with the fiscal year 25. We have a few invoices that are still outstanding payment, so this is not all the way closed. We had worked on getting some of the additional funds out this last year, but have a slightly increased balance from state fiscal year 24 to 25. So we've worked on chipping it down, and we're at near static, 1.9 million to $2 million, and we'll be working on what do we need to do to either get authority or approval to spend that money that's in the account as well. So just wanted to note that this is us describing or sharing with you all what is our account balance. And I will also note that we've been looking at why, what it contributed over this last year to the increased balance. And one of them is the expansion that we got funding for didn't go out until really late. It took a lot of time. And so for our 6 programs that got awarded that expansion, they know that the contracts got signed really late for that. So not as much funding as we expected was spent. We had about 5% underspend of our existing contracts. And then we had some lower than expected salary and benefits within our DCYF team, thanks to many of us having babies and being out on leave. And so those are some of the reasons why the account balance didn't quite stay steady this last year. Why don't you go to the next slide? And then we're going to move to discussion. And I know we've been on this topic for a while, so I'll be curious if we have discussion. And I'm sorry, I'm just tracking chat here. The current fiscal policy issues. So we are in a challenging state budget climate. You all have heard this. We did not do a policy update today, which we often do with our partners in the Office of Public Affairs and our private public partners lead advocate, Erica Hellick, the policy lead there. We will probably do that again at the next meeting, but it is a state budget climate is very challenging. We do not anticipate that there will be new investments. We will likely see additional reductions over this next fiscal year. We'll see what the governor's budget comes out with in December, but the legislature will be grappling again with lower than expected or hoped, I would say, revenues. We have programs that are we have 8 programs that are implementing rates, the rest are not. So as a result of that, we know that we're not fully covering costs of all of our programs. We had probably, Renee shared with me this morning, in state fiscal year 24, about half of our programs fully billed their contract. That means they spent every dollar that was in their contract. This year, it was closer to like 25%, even though we know we're not fully covering costs. So we're in a complex spot right now, and it's unlikely that we'll get additional state revenue this coming year. Again, unlikely. That's my thought, at least. May happen. We don't know. But I just wanted to share this all with you, and then have our 4 programs that shared about their experience with rates, and then just have a discussion with you. I think we'll flip forward maybe 3. You can hop over the 2 rates slides. And I should say, of the 8 programs, the average increase, I think, that program saw of the revenue was about 33%. That was the mean. I think the average or the median was a little higher than that. You can go to keep going, another slide. And then another one. There we go. Thank you. So just, I wanted to ask you all, HVAC, is there anything that you want us to be thinking about at DCYF? Anything that HVAC wants to dig into more as it relates to finances? What are priorities that should be elevated to DCYF? There's not a vote happening. This isn't a formal recommendation, but a discussion for you all a space for conversation among members, hearing what you've heard. Is there additional information that would be helpful for DCOF to share? Just wanted to check in. Where would you like us to focus conversation this coming year at HVAC, or is there anything you want DCOF to really be considering as well? And I think this is, Nellie, where we open it up first for HVAC members and then anyone else. Is that right? Okay. So we'll start with HVAC members. Anyone want to jump in?
I don't even know if this is possible, Laura, but you know, if we're looking at the long-term change fiscally, if there's a way to kind of know what are we thinking that yes, expansions won't happen, but are we also thinking that slots will be cut? You know, if there's a way to have pre-understanding before it hits, I think is the most important thing as a actual agency providing the services. It's harder when you feel like you're hit by a boulder, and if you have the time to kind of work with those rolling stones as they're coming down instead of just the impact of the final decision.
Yeah, I appreciate that. Allison, there's nothing at this point. State agencies haven't been given a formal directive or asked by the governor's office to do any kind of reduction planning. And if that happens, I'm not sure if it will or not. That's what happened last year. And I was out on leave when that happened, but I don't know if that will happen again and what kind of timeline that we'll have and if it'll be possible for us to connect with HVAC on that. But if we can, I appreciate that feedback, and it would be, I agree, it would be helpful to bring that conversation to HVAC if we're able to, if it comes to that. And I'm speaking specifically to the, if the agency has to consider cuts to services based on the budget, which we've not been told at any point yet that that's going to happen. What others?
This is Samantha. I'm just curious with how rates have been in the works for quite some time now. At what point, with the McVie having not approved this, like at what point do we decide that we don't move forward with rates with McVie funded programs? It just seems really difficult, and coming from an agency that chose to close our program due to not being fully funded and not covering the true cost of services, and also not thinking that the rates were going to be enough to make up for, again, being a legacy program, thinking that contracts would be renegotiated over time, but there was never increases. So it just makes me wonder, at what point do we just keep telling people like, yes, rates are coming, we're just waiting for McVie? Or do we have some type of deadline that we decide that that's not an option anymore? It seems like a lot of stress financially on agencies to be still kind of in limbo, not knowing what's going to happen.
I'm pausing to see if others want to, any other members want to offer any thoughts or reflections on your questions, Samantha, before I respond.
Hi, this is Christy, and I'm just wondering with my heart is just heavy for these four groups, thinking about what they've gone through in addition to just keeping home visiting services going strongly throughout the course of the year. As we use their experience, and then we have four more this year, so that would be 8 teams that are getting experience. Will there be wiggle room to really listen to what we're all hearing today and kind of make some adjustments before, our big teams head this direction too? Like, how can we be planning ahead even for where we're at right now? How can we be practicing? Or, I mean, just it sounds like such a heavy lift. So, I guess just my thought of like, are we going to be able to navigate a little sideways where areas didn't work? Or, what's that look like?
But other HVAC members taking notes of these questions. I want to make sure that there's other HVAC members have a chance to jump in too. So my and one thought that I'm having is it is possible for HVAC to put together some thoughts or questions or recommendations as it relates to full implementation. So HVAC could come up with some questions or recommendations as it relates to requesting that DCRF put a formal timeline out for full implementation of rates, including McVie, a statement on McVie. When will that happen? I can tell you that we are working with our finance folks to put together what's required for a McVie approval. That McVie has not denied our approach. We still have to put together some of what's expected for that request. But it could be that HVAC has some collective thoughts that they want to share with DCYF about a timeline for full implementation. That's just, one thing to consider as HVAC members. I'll pause there before I move forward.
This is Dila. I'm just staying off camera because my connection isn't the greatest. I would love to hear more based on Camille's question in the chat of about what is the barrier to moving forward with McVie for McVie programs. Because to me, it actually is a bit, again, of an equity question because if they decide that they won't do rates, then I think that is a decision that other programs should also be able to make as well. And I actually remember asking to be exempt from rates because I didn't think it was a good fit for our organization. and that request was denied. And so I just think in all fairness, if there are choices there, those choices need to be available to every HVAC program.
So for the federal government, it is a specific approval process that we have to go through to move from our current subrecipient process, which is the kind of a contract or monitoring relationship we have with our LAAs or programs who are McBee funded, to what's called a fixed rate subaward. And the federal government has advised us that they have to review our rate structure, our process, or all of that kind of stuff, all of the details basically, because the standard for how the federal government expects these kinds of awards to be managed is through the subrecipient process. Because it is not expected, which we all know, that programs that are implementing this kind of program profit from this. And so part of this is reviewing and assuring that whatever our methodology is a really close approximation to what the actual costs are for implementing the rates or implementing the program. So like, are we getting to a pretty true cost? So the federal government will have to review our rates, the methodology, all of that kind of thing to ensure that it meets basically the standard of pretty close to what the actual costs are. And we'll be working through that here in the coming months as well. And knowing that it will take some time, likely, especially with what's going on with the federal government at this point. But our McBee program actually is not fully, but largely staffed still, because that funding has been approved. It was approved previously. So we are still getting communication from our federal folks at this point. Okay, I'm going to open it generally to discussion. I think I might have answered some of the questions in chat already, but I'm not sure. And Nellie, I know I'm well over time. And so please, we'll stay here another minute or so and then move to whatever's needed next.
I think there was a question that I don't think we have spoken to yet that Camille asked about. Opportunities for feedback. And so there have been kind of ongoing, and there will continue to be kind of opportunities for feedback. HVAC is one of the avenues, and the panel today and the discussion that we were having was an opportunity for HVAC to hear directly from LIAs, because we had not structured that yet for that to happen. And it had been something that we had been having kind of an ongoing conversation with, fully recognizing that there are HVAC members who are LIAs and have been through the rates process. So there has been feedback that has been given kind of more informally as we've talked about rates updates and gone and covered that over the last couple of years. So this was a more kind of formalized space, and as part of an update from the ad hoc committee. So the contracts team, and I think HVAC as a whole, has had a variety of opportunities for feedback to be provided, and will continue to do that. So and those are done kind of in one-on-one. They were done in kind of the model groupings that we've done, and kind of reflections on and kind of planned for rates that have continued to happen. So we'll continue to have different formats, and HVAC won't be the only space. So hopefully, Camille, that gives you kind of an idea of where we've been and kind of where we're headed. And if that doesn't, let us know.
Thanks, Nellie. No, that's so helpful. Thank you for that. Yeah, I think I was just recognizing there are several other sites, whether HVAC members or not, that weren't able to attend today. And so just wanting to make sure, check to see like what that process is for them to also provide feedback. And it sounds like it's kind of in their one-on-ones with their contract specialists or in their model specific meetings, which is great. And just as I continue to learn my role within the HVAC, wanting to know, when should that type of feedback come to HVAC? Is that something HVAC should hear, or does that go to DCYF? So just more of a place of curiosity, wondering how we get that feedback and who should get that feedback. But that's great to hear.
And I'll just add one more thing. We're just analyzing, because like I said, the last state fiscal year just closed. I think of the programs that participated in rates, it was a really, again, overall, with a couple of outliers, pretty significant increases in the amount of revenue that those programs accessed this last year. I think across the 8, several $100,000 more. So.
It's part of an ongoing analysis, and the feedback has been used. I just got a notice that my internet is unstable, so I'm not turn off my camera, but hopefully that will help. And so the feedback has been used in a variety of different ways. The feedback has been shared internally with DCYF of leadership as part of kind of understanding the impact and of current impact, future impact of rates. It's also been used to help kind of make some decisions about where things are going, and has an impact on kind of paths that are taken. So it is ongoing kind of conversations, and it's ongoing things that we're taking a look at. And I think that was also shared as part of kind of the response to holding off on doing holding out. The data committee had asked about whether they could evaluate the rates process. And I think the response to that was it is something that we're actively looking at and collecting, and we'll continue to do so. So it is being collected in one space, and it's being used to kind of influence where we're going. It's also being used to help support decision making. And thanks for that, Renee. Sure, please go ahead, Katie.
Thanks. I guess I'm just thinking, and this is more, again, of a reflection rather than a question that I think you would answer right now, but that's what the prompts are, is I think, Laura, I heard you mention that the majority of contracts are not being fulfilled to their full amount. In fact, it's pretty low. And so did I understand that correctly, that agencies aren't like using up their full grant? Yeah, okay.
Not yet.
And I fully
yep.
understand like
About
what
5% difference or so.
Yeah. What a challenge that presents on all ends. As far as like DCYF, you do want people to use their full contracts, etc. So I'm really wondering what the barriers are to folks using those And then also if you have seen like more success in with the agencies who have switched over to rates, if that's been like more of a straight line. Hi, Renee. I see your comment, and I mean, I could guess what some of the barriers are, but yes.
So the second question around, is it more for rates, are they more fully spent than previously? We're not quite there in our analysis yet,
Yeah,
Katie.
I don't expect you to answer. I think.
Yeah, I was just looking at, yeah, it's a great question for us to look at. And I'm others that are of experienced rates or that are LAs want to share from their perspective, what are the barriers? I'd love to hear that too.
But if
Thank
I
you
could just
for-
say, like, an extrapolation, if the biggest barrier is staffing turnover, and Allison has shared what a barrier that is to rates, that's concerning to me moving forward, considering both like the purpose of the funding is to achieve home visiting outcomes, and you need that money to be getting out to community, and how you can support that happening.
This is Gila. I would guess just from our experience that I do think staffing, recruitment, and turnover definitely impacts work when everything's based on enrollment and rates for sure. The other part of that is the rates are very specific as far as what the funds are used for and sort of like the amounts per certain budget lines. And so there may be more funding available, but actually accessing funding that way is not always that easy. So sometimes we can end up not being able to spend in one area and underspending and overspending in other areas. And I would also say, to be honest, like we did receive an increase in the amount of funding we received by switching to rates. Rather than it just being viewed though as an increase, to me, it's actually more that it's more accurate for the unmet cost of our program for over a decade. So in some ways, the rates adjusted some of the deficits that we had. So it's an increase in funding, but I would almost feel like it almost to me felt like a backfill of being underfunded for several years.
Thanks for sharing that, Dila. Opportunity for one last thought before we transition to the last part of our meeting here.
And maybe if people are willing to share in chat as they ponder this too, how do we want to continue the conversation at the next meeting? I would love, or the following meeting after that, I would love any perspective on, I heard a few things, but and we'll bring it back to the planning committee too, but if anyone has anything that they're like, hey, can we dive in more on this in a subsequent meeting or this kind of discussion, please do suggest that in the chat.
So why don't we just give a couple of minutes for people to do that? It is 11:54. It'll give us just an opportunity to stretch too, because we've been kind of together, and then we'll come back for our piece. So it is 11:54. Let's come back. It's actually 11:55 now. Let's just come back at 12. So please take this opportunity to respond to that prompt in the chat. How do we want to continue the rates conversation? And then just take a couple minutes to stretch, and we'll come back and finish up the last part of our meeting. Just back together at noon. Thank you. I'm sharing my screen and the multiple views. I just still have not mastered kind of how to get everything to do what I need it to do when I need it to do it. And so thank you again. I see the prompts and kind of notes coming up in the chat. Feel free to continue to do that as we move into the last section of our meeting today. And that's really let's spend a little bit more time on the HVAC kind of member recruitment. We spent some time in July just to refresh, and I'm hoping that you had a chance to look at the minutes that were attached to the agenda and the email that went out earlier this week, just to kind of review where we were and the conversation around kind of HVAC member recruitment. So just wanted to pick up where we left off to determine how we're going to move forward. So there'll be a lot of this information that is a review, but helping just to re-ground us in where we were. So when we met in July, we spent a little bit of time just kind of talking about the membership profile and the way that it shows up in the statute. And so the top kind of chart here is what is in the statute, and the bottom one is currently what we have. And the reason I have kind of active in that is because these are the number of people who have come to at least one meeting in the last year. So for state fiscal year 25, they at least attended one meeting. We do have a list of individuals who have not been to a meeting. And I think that'll be kind of a separate ask in between to make sure that we get our roster cleaned up. So if they are, I think the last time when we had this conversation in July, there were individuals that had retired that we had not taken off the list. There were also individuals that had been replaced by somebody now who's actively participating. So we just want to make sure that what we have and identified as a roster is actually reflective of who should actively be an HVAC member. So that roster list will come out as part of the follow-up to this meeting. Just provide any updates. So if somebody's on there that you are 100% sure shouldn't be on there, just let us know. It seems like the cleanest way to kind of have that happen. So this is right now, when we look at our membership, this bottom section here in blue, this is who we have. I didn't list names. And this is who kind of where we've identified that we should be. So we have about 19 active members if everybody kind of shows up together, and we should be between 18 and 26. So we're not far off of where there's a goal to be at. So just wanted to use this as kind of, here's where we are. And then if you look at of what we also identified we wanted to kind of have in regards to membership. So you'll notice that the parent caregiver lived experience experts is on the chart in blue, but isn't reflected kind of on the chart, and that was reflective in the statute. So that's an area that we identified in July. That's an area that we want to ensure that we have kind of representation or voice at the table. So just any thoughts or questions about this two charts here? Okay. I will keep moving here. So this slide represents of who we identified at our meeting that we wanted, our desired voices or voices that weren't necessarily as represented as we would like. Not that these are not current perspectives or voices that are at the table, but we wanted more, or we wanted representation. So it's a combination of both. So just wanted to check in again and see, is there anybody that, any perspective or voice that we had talked about that's not reflected on this slide. Please feel free to unmute and share that, or feel free to put it into the chat. So we'll work with this as kind of a current representation of desired voices and perspectives that we either want to increase or want to have represented. And if anything changes, or if our we want to add to this list, there is always an opportunity to do that. But for our conversation today, we'll focus on what we have here. And again, if there's something in the chat that I miss, please feel free to point my attention to it or pause me, so that we can respond or include. So the other piece, and this is again kind of reflective, the top part, we had a conversation about how we wanted to recruit. We had a conversation about initial conversations about a process. And where we landed was an agreement that a personal connection would work better than a broadcast announcement that HVAC is opening up membership and having everybody and anybody respond. Because there was, I think, some concerns or some questions around, we have it, we open it, and then we may have individuals that aren't selected, so we had a lot of conversation about that. And I think where we landed was that a personal connection, and that could be via an email, via a phone call, a combination, would probably be the best way to approach. So just wanted to check in if that is everybody's recollection. So if that is not reflective of where we landed from your perspective, please feel free to share that, so that, and I want to make sure that we're moving in. And I see that there is a couple of things in the chat that I definitely want to make sure is added to the previous slide. So I see there's wanting to represent, hold on. Okay, I see that, Katie. So let's see. I think there was rural representation, if I saw that correctly, in the chat, as well as workforce. If there's anything else I've missed, please feel free to share that out loud. And Katie, I'm acknowledging that there's a space there where you were mentioning the importance of having people self report, and we can talk through what that would look like. So where I wanted us to spend some time this last part of the meeting is to identify, are we feeling like we're at a place where we are actively rated to recruit? And if we are we identifying a timeline which will help us structure what this process will look like? And I think the process will help support who we end up bringing into this space or adding to. So I think how we do it is also as important as who comes through. So we want to make sure that we have a process and a way that we are of recruiting that is then we're able to share more broadly and we can be transparent about, because I know that those were two more things that we identified in July. We wanted to make sure that whatever it was, that we were transparent about how this process was happening and make sure that it was available. And we talked about the website, but then also wanting to make sure that we have it clear and identified. So the first piece is, are we feeling like we're in a space when we go back to the chart and look at who's currently actively participating and attending, what we've been what was identified as what the makeup of HVAC should be in statute, acknowledging that there is a perspective that was not reflected in that, which was the parent, caregiver, and lived experience experts. Are we at a place where we want to recruit actively at this point? And that's a question to the HVAC members.
Did you send out the list of the folks, or did you said you were going to? I
The
think
list of
I'm ready to
current-
recruit. I think that it's time to refresh the roles. Just knowing the transitions that I've gone through personally, as far as relation to the work. And I think that's true. The landscape has changed a lot, but I don't know like how recently we've added new members overall. So I don't quite have the full picture.
So it has been a long time since we've added new members. Most recent members, I believe, that we've added have been the local implementing agencies, and that was a process, I think, that wrapped up right as I was starting. So 22, I believe, 2022, 2023. So we haven't had any new HVAC members. Well, we've had one person who replaced. I shouldn't say we've had somebody who replaced an individual who shifted to a different position. So we've had replacements in that way, but not new, kind of actively recruited. So we've had individuals who have shifted positions within their agencies, and they've had somebody take over for them on HVAC since I've started, but not a kind of a recruitment effort in the way that we're talking about it now. So I hear Katie saying yes. Why don't we just do this by a show of hands? So if you think we're at a point in a time where we need to kind of focus and recruit, and that would be recruiting over this year, kind of hopefully people would start in the fiscal year of 27, which would be next July-ish, after next July. Could you raise your hand? I see Christy, Bridget. I see Adrian. I'll just give another minute or two. Okay. I'm also just kind of counting the number of members we have here just to see what representation this is of the current participants. Okay. Okay. And Adrian, did you mean to put your hand down, or just want to make sure we are counting everybody who's voted?
No, you can count me.
Okay, perfect. Oh, Samantha, I'm sorry. Was there something you wanted me to repeat?
Sorry, just repeating what we were raising our hand for. I just missed the tail end of it.
That's okay. Thanks for asking. So I'm asking if we want to recruit this year for new HVAC members, and asking those who are interested in doing that to raise their hands.
Okay, thank you.
Thank you, Martha. I see your support there. And okay, so it looks like, thank you all. It looks like we are, majority of the members who are here in support of that. Great. Okay. So that's step one. So I'm gonna, yay, we've got a decision and a way forward. So what I would want to ask next is, can we have some volunteers to work on this a little bit separately? Because I think there's components of it that require some out of kind of HVAC committee time to put together a structure to kind of really think through a process and then be able to share it in the space with the larger kind of committee as part of moving this work forward. I think it would be really difficult to do in kind of a meeting to develop all of these pieces. So what are members' thoughts about kind of having a smaller group of people work on this and come back and talk through kind of what suggested process, or just kind of talk through a way to move forward with recruitment?
Nellie, can I ask a question? This is Nina.
Sure.
And I'm not as a trio. I know if you need me to wait, I hope it. But I was thinking about the DOH presentation where they showed that picture about housing and access to health care and that sort of thing. And I'm wondering, and we've been talking about kind of the who and the where, but I'm also wondering if we could add those factors into like do we have somebody that has housing that is implementing housing services, or those things that we know that families are already reporting on, that are the barrier or the key things that they're concerned about. So just a popped in my head. I just wanted to share that.
Thanks, Nina. I think it's a good perspective as we think about kind of what voices or what perspectives or what representation we're missing as part of kind of addressing the goals and the values and kind of all of the pieces that make up HVAC. So I think that's an important thing to consider. And that may be kind of what falls into the allied professional kind of grouping or category. So do we have a couple of people? Do we have 3 people who would be willing to be part of this? And it's not a huge ask of time. Probably between now and December, I would say 2 or 2 or 3 meetings at an hour. So that would be 3 hours between now and December when we meet. So I will ask that you consider it, ask that you kind of think about that, and what we may also, I'll connect with Gretchen and Marilyn, and we may kind of reach out and see if people might have capacity to do that. So you may get an email prompt or something asking for your time, and hopefully it will be something that will work for you. And again, between now and when we connect, if there is somebody who kind of needs to think about it, or please feel free to reach out to me if that's part of what you are interested in doing. So we'll move forward with kind of looking at and thinking through recruitment pieces. So part of what we will do in December is kind of identify, the group hopefully will work on identifying kind of a timeline for the HVAC members to respond to, kind of also really thinking about where we like who we want to make personal connections. There may be kind of hopefully opportunities for you to volunteer if there are connections that you have, which, like Martha has kind of shared, that she would be happy to support of recruitment of external researchers. So if there's an area, as we're looking at kind of the voices and perspectives that are missing, if there's a connection that you have, or somebody that you think would be great to have added to this, that you would also kind of look at that and consider that as part of kind of preparation for our kind of journey through recruitment over this next year. Any questions or thoughts about that? Just have a couple more slides. I think we've gone through the questions. All right, so our last little piece here is the subcommittees. So I think the first one is our data subcommittee. Wasn't sure if there was something in particular you wanted to kind of talk about or share, Martha?
Yeah, thanks, Nellie. We are having a meeting today. We'll start at 1. Let me see. Our agenda will look a little bit at the subcommittee purpose and also some recruitment ideas. We do need to recruit for a new co-chair. And then we just kind of want to reset the table and think about what are the data and information needs and the analytic needs of the HVAC, and where do we want to kind of dig in this next year. All are welcome.
And when we come back, can we be put as co-hosts too, so that we can run our own stuff in our groups? Thanks.
Yes. You're on, Nina.
Okay. I don't know if there's a handout that I did that I actually just did an overview of the various reports that we've made this last fiscal year. It's been quite a while since the workforce subcommittee has met, so we're just going to kind of reboot and do a quick, this is where we've been. This is where the committee is at right now, we think. Do we have the right mix? Do we want to add people? And just look at the schedule for HVAC meetings coming up, and is that enough time together, and just have conversations about both how we're going to structure the work, but also some nudges for us to reflect on relative to the deeper dive conversations at the next meeting. Since this is the first go around, it's kind of like restarting the engine. So yeah, that's all I have to say. Thank you.
Nina, I have that document. I'll drop it in the chat here before the break.
Okay.
Any questions for our subcommittee leads? I'm not hearing anybody, and I don't think there's anything in the chat. If I've missed any in the chat, let me know. And so we just wanted to take this last little bit. I'm going to stop sharing here so I can actually see. Take the last couple of minutes before we break to have you spend some time completing the survey. So if you could take the next couple of minutes, open up the survey and complete that. I'm going to work on getting the document that Nina mentioned, the update document, dropped into the chat as well. So give a couple of minutes here, and then we'll do kind of our final wrap up, and then our lunch break, and give some instructions for the subcommittee. So I'm just going to be quiet here for a little bit and give you some time to complete the survey. Thank you. I am sure there's probably several of you who are still making your way through the survey. Thank you for taking the time to complete it. And I just want to wrap up and give some instructions for the subcommittees, but please feel free to continue to fill out your survey. So just want to start off by saying thank you for being here and being engaged. And I know that this is not a small commitment of time. So thank you for doing that. Thank you for participating. For special thank you to our panelists who are still here. I know we had several who had to log off. Thank you for how candid and open you were about your experience. Also acknowledging and thank you, Dila, for pointing out that there is a power imbalance even when you're being asked some positive things. So thank you for taking the time to do that and to be authentic and honest in that space. As for the subcommittees, we're going to come back together here and this particular link. And from here, we'll divide into we'll have one group stay in the main room. We'll have a breakout room for the other subcommittee. And then that way we'll have each of the subcommittees running during this time. It'll be from 1 to 2. So we have a 30-minute lunch break between 12:30 and 1. So feel free to log off of this if you want to. I'm going to leave my computer connected. So it's fine if you want to turn your screen off and continue to do other things, but stay logged on, or you can log off and log back on. So again, thank you all so much. And please, if you're not done with your survey, continue to fill that out. We'll also have the survey in the follow-up documentation for those who might have had to leave a little bit early. Again, looking forward to connecting with you in December. Take care. And there may be some of you that we connect with a little bit ahead of time to help us with the recruitment pieces. So have a great rest of your Thursday and a great rest of your week and into your weekend.